Hope Channel, changing lives.
Hello, lovely people. Greetings to you all, and I hope you're doing well and your day has been good. I come your way with a special greetings to you, and I welcome you also in a special way to Love at Home. My name is Nana Akusia Boachi, and I'm sitting in for my dearest aunt, Efia Sewa Mansa. Aunt Efia, wherever you are, greetings to you and the family. See, last week, we started with an interesting topic, mental health when it comes to family. Actually, the whole month of September, that's what we'll be discussing. And here in Ghana, you and I know, last week, Auntie Efia mentioned it. It's not easy. Mental health, especially here in Ghana, Africa as a whole, but since we're in Ghana, let's talk about Ghana. It's difficult when you're discussing mental health because it's barely discussed, and we have to pay attention to it. The more reason why this month we don't want you going anywhere. In fact, all the episodes is going to be a wonderful, conversation, and we want you to be educated so that it will help you, your friends, your family, the people around you, the church, and the country you find yourself in. So please, don't move, don't go anywhere. We're going for a quick break. And when we're back, I'll introduce to you who is going to help us discuss this. Please, I said don't move. Maybe you think it's malaria or fever you're having. It might be mental health. So stay tuned. We'll be right back after the break.
I am an angel of hope.
I'm an angel of hope.
Ubrenio, so do Sika a Baba Hope Channel. No, so ya sene, yet me the mere some a cook main chia saw in Choromiana, Wadaroma, Farmain, Nafa Sika Fasubi, na also Fabra, Yanko Kanyamsem, and ya cra a wonkwa. Star 928 star 34 star 104 hash. Anase 0249 193083. Hope Channel, yes, it's Sabrabo. Hope Channel, yeah, Gia Cranomqua.
We just joined. This is Love at Home, and today we are going to discuss the signs and symptoms when it comes to mental health. Before fire will escalate, it starts in a small quantity. But then when it comes to mental health, most of the time it has to start somewhere, and that is where the problem is, because we don't notice it. Somehow too, we might not even have any idea of how it starts or how it goes about, because before someone will be depressed, it's a piled up emotions. So when you ask the person what is wrong with you, they can't even describe what is really wrong, because they don't know where to start from and to end. In our part of the world, how are we handling mental health? How do we know? How do we see? That is what we are discussing. So please tell a friend that if he or she is not even at home, they can watch on our YouTube page or Facebook page. YouTube is Hope Channel Ghana, Facebook, Hope TV Ghana. Just drop your comment, your questions as the discussion goes on. And reminding you, Love at Home and all other lovely programs you enjoy on Hope Channel Ghana is brought to you by Angels of Hope. You too can be an angel of hope. Just pick up your phone and dial *928*34*104#. Or you can drop your donation to 02491-93083 and you automatically become an angel of hope. If you want this message to keep helping people, then support Hope Channel. All right, so speaking of mental health, to help us discuss this issue, last week he was here, and in fact, the Hope September, you're going to see him here. He is TOP Aaron. Okay, Aaron Ba. He's actually a clinical psychiatric officer and a mental health practitioner. Dog, good evening to you.
Fine evening.
Hope you're doing well.
I'm doing great by the grace of God.
I hope the day went well.
Yeah, it went well.
We thank God.
Yeah.
Last week we started with mental health.
Yeah.
For the sake of people who are now joining us today, a little bit overview of what mental health is.
Well, when we talk about mental health, all that we're trying to say is that, to explain it, is that it is the ability of an organism. You know, in psychology, in psychiatry, when we say organism, we mean human beings and animals.
Yeah.
Because mostly animals are used in the study, and then the result that comes out, it affects human beings equally. So it is a study of the ability of the organism to be able to live with strain and stress by making use of the environment in order to lead a normal life. And just like I said, from the beginning of man creation, that is inception, when you are in utero or in a womb, the stress starts from that place. When the semen are released, they compete to go and fertilize the egg. And in the course of the competition, the one that gets there first and get into it, the rest are closed. So it is a struggle. Then when you are in utero, you go through stress. When your mother is suffering, you are also suffering. Till the day of birth to is another problem. When you come to, then you are not coming to face the real problem.
It's like the hustle is
Yeah.
right from the
So we are born, we are conceived in stress, we are born with stress, we live in stress, but we must enjoy life.
Of course.
So we make use of the things that are around it in order to lead a normal life. So that is what all mental health is about.
Lovely one. So my dear, the hustle is real.
Yeah.
But dog,
Yeah.
do one have to be mad before we say that this person has a mental health? Or when do we say that somebody is battling with mental health?
Yeah, we say someone have mental ill health when the person is not able to enjoy life, is not able to live with the normal way of him or her doing his things so that he can be able to enjoy life. If the person is not able to do that, then we say the person have mental ill health. It's not necessary that he will be kicking things left, right, center, walking on the street, going naked, before we say that the person have a mental ill health. No.
I be in Ghana, that's what mostly happens.
Yeah, but if you are not able to function well, to enjoy life that God has given us to enjoy, then you are having a mental health issues. That is why you are not able to enjoy life.
What are some of the common mental illnesses people actually suffer from?
In fact, the common mental illness that people suffer from, which we don't pay attention to it, then later it escalates, is anxiety and stress. It is something that we go through every day.
You know, as you said, every day, someone says stress is normal. It's part
Yeah.
of every human being. So,
Yeah.
of course, it shouldn't be a big deal.
Yeah.
So why is it a big deal?
Yeah, it becomes a big deal when it affects the person way of functioning, that he cannot enjoy life, then it is a problem. Okay? When you have an issue, and the issue is weighing on you, that it bothers your whole mind for the whole day, that because of that you cannot do anything productive, then it is a challenge. Then when it is repeated and it continues 3 days, 1 week, 2 weeks going, then it becomes a big problem. For example, if you are the breadwinner for the home, and then you cannot go to work so that you can bring something home by the end of the month or by the end of the day, then you see that it's not only affecting you, but we're affecting the whole family. So anything that can disrupt one functioning to become productive, it is a mental health issue.
Isn't it scary? You mentioned if the person can't be active, the person can't work. What of those who still go to work? You know, you have a colleague at work, even at home, your husband or your wife, your siblings. You see, they're still functioning.
Yeah.
They are still doing their work. They go to work. What is expected of them at the office, they do.
Yeah.
At home, they do.
Yeah.
In school, they do. Your
Yeah.
friends are still the same thing, bubbling kind of. Isn't that scary?
Yeah, it becomes scary in the sense that the fact that the person may be able to be going to school, going to work, but is it productive? It is not presenting yourself at the workplace that makes it to be productive. But if you are able to discharge your duty that is profitable to you, to the company that you're working for, and to the society, then we say it is productive. But if you go and then you say that you yourself, when you assess yourself, you see that your output for the day is not acceptable, then it begins to weigh down on you. Then as the days go by, then it will be diminishing, it will rather be coming down. Then it is only when it escalates that we know that you have mental health issues. But it starts. So that is why today's topic is very good, that when we know the early signs and symptoms, then we can be able to see that, no, this is what is happening. So let us check it before it gets out of hand.
So what are some of the signs that one has to look out for to notice that this person is having a mental issue? What the person hasn't changed? Because if my friend is still as bubbling and jovial and then all over the place as usual, nothing has changed. If it's my colleague, he or she comes to work, still active. My husband is still active, talks to me like the usual way. He comes back from work, we have a conversation, we pray, like nothing has really changed. How would I be able to detect that my husband, my wife, my son or daughter, my colleague at the office, or my fellow student is battling with mental health?
Yeah. If our mental health, like some of the health sciences, deals with something that we call symptomatology. When we say symptomatology, it just means that it's a branch of science that deals with the study and the characteristics of health issues. Okay. So in mental health, we have the person will be presenting some signs and symptoms of ill mental health. And let me talk about the symptoms first. Yeah. The symptoms, to put it in the ordinary way for one to understand, is that when one is having some feelings that you alone feel that if you don't tell me, I wouldn't know that this is what is going on. They are the things that we call the symptoms.
Okay.
Now, a few examples I can give you about symptoms of mental health is the person may be complaining that at night I can't sleep. He or she goes to bed. The day is meant for us to work. At least night you must sleep and rest the body so that you can be rejuvenated the following day, so so that you can be able to go to work. But if the person is not able to sleep at night consistently for 2 weeks or more, then it's becoming a challenge. If the person don't tell you, you wouldn't know. So it is a symptoms. Then sometimes they also complain of persistent headaches. Persistent what? Headaches. They may complain of persistent headaches. And that persistent headache don't go away with painkillers or the analgesic. It doesn't go away with painkillers for some time.
Oh, really?
Yeah. The person, it comes, you take paracetamol, then it goes. Then about 2 weeks later, 3 weeks, you take the paracetamol, it's no longer going. It doesn't work. Then it may be a mental health issue or epilepsy. Epilepsy too can also behave in that way. Then another symptoms of ill mental health is that the person is not happy within herself, but he or she will be massaging it. Then it will be slowing down the person's way of normal functioning. It's another symptom of ill mental health. When it persists for a longer period, 2 weeks or more than 2 weeks. Then another symptoms too of mental ill health is that the person will be hearing strange voices talking to her. I'm talking of strange voice. Why is the voice strange? As we are here, I'm talking to you, you see me, and you hear me talking to you.
Yes.
But here is the case, the person is hearing the voice in the ears, through the ears.
Like someone is whispering or something.
Like somebody whispering, but there's nobody around. But he or she hears the voice talking to her.
Meaning that she's not actually possessed, or here in Ghana most of the time when you say that, like, oh, you're vampire, probably is the devil or is a witch or you're possessed, something like that.
That is why, that is the more reason why when mental ill health issues come, they run to the prayer camps. Because the person is hearing strange voices talking to him or her. So if she should voice this thing out to them, then because we are Africans, we are very, very superstitious. Very, very. Then it may be some spiritual issues. Then they run to that place. But it is not. Then the person too may also see strange things that nobody sees. Then we say that, don't you see them coming? The police are coming. The animals are coming. I can see somebody walking on the wall. But you and I don't see the person.
Walking on the wall.
Walking on the walls. Sometimes it's strange. So if the person should voice this thing out, how possible can somebody walk on the wall? So the next thing you see that, oh, then it is an evil spirit. Or you can see them in the skies. They are running to come and catch him. Police are coming to catch him or her. And you and I don't see them. They are signs of mental ill health.
Most of the time we conclude that, are you not hallucinating,
And that is hallucinating. Because hallucination is having you are experiencing the perception, but there is nothing which is making the perception to be felt. It is not there. Okay? I talk to you, you hear me talk, you see me talk, and you hear me. But this time, you are hearing the voice, but there is no stimulus. Nothing is making noise. Some they can hear noises of animals, snakes, all manner of things. They hear them. It is sickness. Yeah, that is what we call the hallucination. And it can affect any of the five senses. Somebody can be there and you see that one is there, you feel that the ants are crawling on the body. You can feel lizards walking on the body. And you and I don't see it. And sometimes we tell you, this is a lizard, but you and I don't see the lizard. He's hallucinating because the perception, he's feeling it, but the stimulus is not there. but he's feeling it. Another symptoms of mental illness is that the person will be there and then he's searching for his mind in his own head and he can't find it. So he said the head is empty. There is nothing in the head. The head is empty. It's another sign of symptoms of mental illness. Then sometimes the person when the person goes out, he said people are looking at her or him. Everybody is looking at him. So because of that, that is why they keep themselves in. Because he's walking and everybody is looking at her or him. That's the way he or she sees it. But it is not true. Sometimes the person will be there and he says that when they get out, they've mounted some gadgets somewhere and they are scanning her, videoing her. So they've put her on the internet and she's on the internet. And everybody, even in the bathhouse. So sometimes that would be the reason why she wouldn't bath. Because once she's in a bathhouse, they'll put her naked on the internet. Another one too, that when the person is there and you are listening to news, either on the radio or the TV, whatever they are saying, he says they are talking about her. Could you call the ideas of reference? They are talking about her.
This is very serious. Very serious.
Yes. So they put her on the internet. So all her secrets and everything is exposed. So because of that, he will keep herself in or keep himself in. Another symptom too of mental illness is that the person when he's there, he says he hears the heart talking. There is voice coming from the heart. The heart is talking. Or he is hearing his own mind or her own mind talking to her. So because of that, sometimes when it becomes severe, you may see them putting cotton into their ears so that they wouldn't hear the voices, but still they'll be hearing the voices talking to them. They look to be funny. And the way it is, and then these spiritual people, knowing that we are very, very superstitious, then they will tell you that what is happening to you, it is not a hospital matter. These are, they have to do something, some rituals. Then they are kept in the prayer camps, and they will be there in the name of fasting, praying, and then when the thing escalates, then they chain them, which also amount to infringing on the rights of the people. Mm-hmm. Another symptoms of mental illness is that when the person is there, he said the mind that is in his head has been corrupted. And some people have put their mind into his mind or her mind. And they are now manipulating her or they are controlling her. So whatever he or she does, she's not the one who is doing it, but it is somebody else who is using her body or his body in doing the thing. Ah. Yes. The person will be there. Then, if you see that he has to get up to go and do something, it is not he or she doing it, but somebody is using her body in doing it, his body in doing it. So all that he's doing is like he's passive. Not him, not her, but she's being manipulated to do it. So if you should go and tell this thing to a medicinal man or a spiritual man, then we say that no, this one, they are the work of the evil spirits, that they are doing that. But that is the way the person is feeling. Another symptoms of mental illness is that when the person opens her mouth, sometimes you'll be seeing fire coming from his mouth. She'll be seeing worms coming from his mouth. One other serious thing about mental ill health too is that the person will be there and he say part of the body is diseased, like the stomach is taken away. So he's there, he hasn't got stomach, or the intestine, the whole intestine is taken away, or the whole intestine is rotting. So because it's rotting, he hasn't got intestine to eat. So you serve him food, he wouldn't eat.
You know, it's might sound a bit funny, dog, but it's a serious issue.
Oh yes, there are serious issues, and that is why the education need to go on, so that people should know that these things that you are going through, it is mental ill health. But these things, they are the things that the patient is feeling himself or herself alone. So that if he should not tell you, you wouldn't know. Okay? So, to the layman, what are the signs? We are not coming to deal with the signs. What are the signs that you will see with somebody? Then maybe your mind should be telling you that he may be having mental health issues. And the typical one among them is that the person is not happy. They don't feel happy. The way you know the person before, the person no longer feels happy. So the person is keeping to herself or himself. May go to school or may go to work and wouldn't get to the workplace because he thinks the problem is there and will go and hide. Sometimes he wouldn't go out even at all. So if you begin to see those things, then you should know that there is something wrong with Akosua or there is something wrong with Joseph. Another sign of mental ill health is that the person is sitting down alone and she's talking and laughing inappropriately. So inappropriate laughter is a sign of mental ill health.
What if you ask the person tells you, oh, I just had a flashback of something that happened last week or over the weekend. And so, oh, we've been cemetery na mystery, that kind of thing.
Yeah. But it will not be once. She said it first, you heard it. Then it is repeating. Then it's becoming a routine that all the time. And you know that that is not the way the person is before. So with this education, then your mind begins to click, no, then there might be something wrong. Another also sign of mental illness is that when you cook food for the person and the food is served, then the person say that the food that is served, you serve rice and say it is gogomi that you serve for her. It is worms, so you wouldn't eat. Rice that you have served and you have eaten, she is saying that it is worms. Then it should be a sign to be telling you that no, there is something going wrong. Then another one will be there, and sometime all of a sudden, when it becomes intense, this time the person will come and even attack you. That you are the one who is doing the thing. Or sometimes they mostly target people that they are not nice with. They think they are the cause of the problem. So if you are in the house with her or with him, and sometimes he or she does something that you try to rebuke him or her about it, and then those things develop, then you say you are the one who is doing those things. So the person will become angry with you. He will not be nice with you, very aggressive towards you, or cold towards you. Wouldn't like to take anything of yours. You should know that it's a sign of mental illness. Then, another one, a big sign of mental illness is that the person will become too prayerful over religiosity. So much so that all the time he or she is praying, casting out the work of the devil against her or against the family or anything about her. So all the time praying and fasting, and it may become so much so that you say, this is not the Akosua I know.
But dog,
yes.
You see, where we find ourselves, especially here in Ghana.
Yeah.
Praying, already the Bible says we should pray without ceasing, right?
Yeah.
Viewers.
Yeah.
And our viewers will agree.
Good.
So, what if the person tells you, oh, dog, or Akosia or Ajoa, see, I feel like I'm distancing myself from God. Now I want to be more closer to God in prayers.
Yeah.
That is why I'm praying frequently. Because, of course, prayers are not bad.
Yeah. The Bible says that we should pray without ceasing. Yeah, it is true, and we should pray without ceasing. But this is the Akosia you know that she prays. But Akosia don't pray in the mid of the night, disturbing everybody. But for some time now, even the household, you can't sleep. And Akosia is praying, casting out demons that the devil are attacking her every day in the night. She wouldn't sleep, and she's praying and she's fasting. And Akosia, who weigh about 80 kilograms, now when you weigh her, it is 40 kg. So you should know that there is something wrong. So she has now deviated from the normal. In fact, there's a thin line between normality and abnormality. And whatever we do in our normal life, the moment mental illness sets in, then we begin to do it too excessive. And then it even goes overboard. Okay? We say that there is freedom for everybody. Mm-hmm. But your freedom ends at where my nose begins. So where my nose is, your freedom ends there. So if we should pray without ceasing, and you are praying throughout the night that nobody can be able to sleep, then it is another problem. You could be couples, and then one like developmental ill health like this, you'll be praying and it wouldn't make you to sleep. Don't you see what is coming? Let us pray in the night, or let us pray every night. Let's pray 1 week, 2 weeks, 1 month, and you are on the prayers, and this time you cannot even sleep. You go to work and you are dozing off. It is a problem. So any normal thing that somebody does, but it's becoming too excessive, that is disrupting the person's day-to-day function or normal life, there is a question mark that needed to be investigated. There is a question mark. Another sign of mental illness that you can also see is that when the person wakes up, everybody knows what he or she does. But this time, there is one thing that the person will be doing. You see the person, good morning. He has to kneel down and then respond to the good morning. You serve food for the person to eat, or the person wants to eat food. He or she will kneel down and pray excessively before he eat the food. The person is going to bath. He will kneel down at the door, pray excessively before going to bath. The person who wanted to smear herself with pomade, she has to, everything that she will do, she will pray and kneel down excessively before he or she does it. And that is not her normal that you know. We call it ritualistic. It is a ritual that the person is doing. If you know that it is a mental, it may be a mental ill health that you need to take the person to, or encourage the person to go to the hospital for assessment. Another one too is that the person can be withdrawn, close and lock the door. Then just like we say, when you go and you say, I'm fasting. Dry fasting. And our body is made up of 70% of fluid. And the person is fasting for 1 week, no water. 2 weeks, no water. 3 weeks. If you don't break the door, then you should be ready to buy a coffin. Because the body cannot stay to a certain degree without water. And when you get to that time, and nothing is done early, the person may pass on. So anything that anybody does, that the thing is becoming excessive, that is disrupting the person's day-to-day function, there is a question mark that needed to be investigated. Yeah.
You know, all of these things, the signs and symptoms we see. Remember earlier I made mention of there are some too who didn't actually showcase some of these things.
Yeah.
They are still happy, as I said earlier.
Yeah.
Bubbling around, having the conversation, maybe not praying excessively as you're saying, or showing some of these things you mentioned. They are still themselves, but they are hurting inside.
Yes, but they will always pop up. You see, yeah, like you see, I saw a client, and then they came. Some people came with a client, and when I saw them and the way they were talking, they wanted me to educate them more on mental health, and I educated them. Then during the course of the education, then one lady said, "No, there's a certain lady in our office. She thinks the lady has a mental problem." They were with her about what he was doing. They never knew. This lady, she goes to work earlier than any other person in their office over there. She's very, very prayerful. And the reason why she goes to work earlier than everybody is that she has to get there first, pray and destroy the work of the devil before anybody comes. So when you come, it means she has prayed already, so his God is there before you have come. So one time, somebody went to work earlier before her. That day, she never talked to that lady throughout. And unfortunate for them, before I said this thing, the lady cast her mind back was that when the one who came to work earlier went out and there was coming and there was a work that should be done by her and you brought the file to her, she said she will not handle the file. She won't touch the file.
Just because she came earlier before her?
Yes, she won't touch the file. Oh, and I said, oh, why? You know, this thing, the deputy said I should bring it to you. He said, no, you won't touch the file. You should take the file from the table. So the lady have to take the file and go and work on it. She never talked to that lady the whole day. Since then, she has never been talking to that lady. Then, another time, somebody also came to work earlier before her. She also did not talk to that. So when I talk about the way mental health is, sometimes the workplace, people may have some clear way of doing things and this thing. Sometimes some of them could be behavioral, some behavior that they are, but most of them, they are mental health issues.
It's not mood swings.
Mood swings too is another mental health issue. But when the moment the person is able to conduct his or her day-to-day function, it is not a problem. But if it begins to disrupt her functioning, then it's an issue to be dealt with. But it's a mental health issue. But once it's leading her normal life, then life must go on. But if it begins to disrupt her day-to-day function or somebody's day-to-day function, then it's a problem that needed to be dealt with.
Doc, what actually causes this mental health?
The causes of mental health is still being investigated. But there are a lot of assumptions. That one, it is believed that and accepted that mental ill health run in families. If I did psychiatry before I understood our old men when they say that Seube Warrior Komisa.
Do that background check.
Yes, I did psychiatry before I understood them. It ran in families.
Hey, Doc, you are going to prevent some people from getting married.
Oh, not that Yeah, yeah, it's run in families. I mean, there is enough evidence to prove that it's run in families. But for somebody to get mental health issue, two things must come to play. If you have one and the other one is not there, it doesn't come. So there are the things we call it the intrinsic factors, that are things that are in you that can predispose someone to get mental health issue. And then the extrinsic factors, that is the environment. So the two must come to play before one will develop mental ill health. If one is there and the other one is not there, one will not get mental ill health. Yeah.
This is really serious. You know, with mental health issue, dog, most of the time people talk of some of the causes.
Yeah.
Stress from
Yes.
work, as you said.
Yes.
And most of the time when it starts like that, you feel, I'm just tired.
Yeah.
You know, the work is piled up.
Yeah.
And then gradually it's like, it's really pressing down on you.
Yeah.
And sometimes even relationship, marriage issues, abuses, you know, happening around you. And then you keeping quiet because you find yourself in a society or you're part of a religion that you can actually voice it out. But immediately you mention it out, please pray. Nyame bɛyɛ ama wo. Some of these causes of this abuse, how can we even pause it? Because before fire will, as I said earlier, before fire will just escalate around, it starts in a little form.
Yeah.
So how can I fix that?
Yeah, just like we are saying, stress. Yeah, stress is related to mental ill health. Stress. Yes. When one is stressful, it means there are things bordering on the mind, and the mind is not able to process them. And when the mind is not able to process it, it will affect the whole body. How and why will it affect the whole body? You know, the whole body is connected to the mind, the head. So anything that bothers the mind have a rippling effect on the body. So why should you sit down and allow work to pile up on you? Then there will be a time that it is demanded in a very short time that you have to involve yourself in it so much to do it so that you can be able to present it. Also, from managers, why do you also try to stress up your worker by overloading the person to do more than he or she can be able to accommodate? If you do that, you are putting stress on the person. And the person will grapple with it, work with it, but if it's overwhelmed the person will just break down, he cannot do it. Okay? So yes, that is why I said that positive mental health is the ability of the organism to be able to live with strain and stress. They are already there before we are born into it. But we must be able to live with it by planning our time very well so that we can be able to execute them in such a manner that will not put too much weight, stress on the body. But if we allow it to accumulate, and then there's a short period for us to be able to execute it, that is where the stress will come from. So, if we know that stress can cause mental ill health, then what you and I need to do is that we shouldn't stress our neighbor. Let's not put too much stress on the person, okay? Because if you are demanding what the person don't have from him or her, you are putting so much stress on the body, on the person. And the person will break down because he or she will accommodate it to a certain degree. Then it will get to a time he can no longer accommodate it. Then it will have to explode, and that is where the person blown out, and then you develop mental ill health. So yes, you can be born with it, stress, Also one, marital issues can also bring toxic relationship, can make somebody to develop mental ill health. Because in a relationship, when spouses are there, everybody has a role to play. And you must play it effectively. And you must appreciate whatever the other partner does. But there are some people that they are not show love, they are not sure what appreciation is. So when he or she grows, he also don't know it because he cannot give what he don't have. So the way we are also brought up, even it is another determinant for somebody to develop mental ill health or not. The way we are brought up.
Doc, I would like you to hold on to this.
Yeah.
Because it's very crucial. The way we were brought up,
Yeah.
or how we are brought up, also contributes to our mental health. Dear one, we need to go for a quick break. Just be thinking about this. We'll be right back. Don't go anywhere.
It's back again. Mission 2023 is back again. United Service to Africa, in partnership with Anikant Community Center and Ghana Adventist Health Service, is back with its 4th medical and evangelistic mission trip to Ghana from the 1st to 15th October 2023. The mission includes surgeries for conditions like hernia, hemorrhoid, and cataract, plastic surgery, medical, dental, eye care. Are you an anesthesiologist, general surgeon, internist, family medicine physician, dentist, ophthalmologist, optometrics, nurse, and pharmacist? You can also be part of our prestigious volunteers. You can also send your donations to our Zelle account, www.unsta.org. Mobile, +195 184 09517 or +233 244 464692 or through our website unitedservice2africa.org. Registration is ongoing at these locations: Valley View University Adventist Hospital, Techiman; Asaman SDA Hospital, Asaman; Namong SDA Hospital, Namong; Wadbok Eye Services, Kaswa Central Region; Kwadaso SDA Hospital, Kumasi; Sunyane SDA Hospital, Bono Region; and Shopo Dental Unit, Odium, Kumasi. Sponsors: United Service to Africa, Anikant Community Center, Ghana Adventist Health Service, Riverside Ghanaian SDA Church, Lomalinda University Health, Savamanga Family Trust, Tasadia Foundation, Charity Vision, All Network Adventist Healthcare Professionals, Diwali Band Trust, Kittering Health, Project Ghana, North Studios Ghana, and our Perigraph Foundation. Media partners: Nob TV Ghana, Hope TV Ghana, and Focal TV.
Welcome back from the break. If you just joined, this is Love at Home, and we're discussing mental health signs and symptoms. It's a serious one. And before we went on the break, Doc has mentioned a lot, but one of the most important thing he has mentioned before we went on the break is the fact that how we grew up or we were brought up also contribute massively to our mental health. Doc, please explain further what you meant with how we were brought up or how we grew up, we were trained, contribute highly to our mental health.
Yeah. In fact, how we are brought up contributes immensely to our mental ill health or to our mental positive health. It contributes a lot. I'll give you a scenario and then you understand me. You see a giant that fear cockroach. And that giant was taught to fear cockroach by the mother. The father also feared cockroach. So the father was also taught by the mother to fear cockroach. So when he married the wife, and the wife knows that if there is any stress or danger at home, it is the husband that needed to be at the rescue. Here is the man. When the man says, cockroach, Kweku, come now. Then the father will raise up the leg and hold Kweku to him. And cockroach will have to run away. So Kweku will be taught to fear cockroach. And here is Kweku that he's thick, tall, like anything, but he was taught to fear cockroach.
Then I think there's an issue. Those people saying that fear women, we beg you. You're not helping our mental health. You are not helping our mental health.
So with that fear, Kweku, when he see cockroach, even dead cockroach lying down, he wouldn't go near it because he's taught to fear cockroach. Because when he was coming, he have trust and security in the parents. And the people that he have trust and security in them, that if I get Kweku and I want to beat him, Kweku will run, and when he's in the mother's lap, he's safe. He says, if you can beat mommy, then beat me. Here is the case that mommy see cockroach and he's cutting Kweku. Daddy see cockroach, he cut Kweku and hold Kweku. So Kweku know that cockroach is very fearful. So don't get near to cockroach. So Kweku will grow and he will fear cockroach. He's taught by the parents. Are you getting me? Mm-hmm. If our parents teach us how to be assertive, so that we are trained to be able to speak out our mind in a responsible manner of anyway, so that when there is something lingering on your mind and it seems not to understand it, you speak it out or you ask, and then it is explained to you. Then when it is explained to you, you now become satisfied. Mm-hmm. But if you are not taught to be assertive, and everything you have to swallow it the way it is, meanwhile, you are convincing yourself that what they are saying is not true. Okay? For example, somebody who is religious, study the Bible well, taught the Bible well, he knows the Bible well, know that there is no ghost. Yeah. Then you are telling him that there is ghost, and you know that there is no ghost, and you want him to fear ghosts, that he is aware that there is no ghost. So you see that there will be a conflict between what you are teaching or telling her or him versus what he knows. Okay? So when he is able to prove to you that if you say there is ghosts, let me see the ghost, take me to see the ghost, and you are not able to make the ghost available to the person, there will be a conflict between you and the person. Okay? So, if we are taught to be very assertive so that we can ask dark questions on our mind to be cleared, then we will always have free mind and there will be nothing bothering our mind. We must be fair and objective no matter who the person is. Don't sit on the comfort of somebody. Well, your right is your right. Yeah. And there shouldn't be any way that your right will be sold to you cheaply, and because it is cheap you have to buy it. No. You don't have to buy your right. You must enjoy it. Okay? So if somebody wants to sell your right for you and you don't want to buy it, you have conflict with the person. And this is what is bringing the tension in us. So in all manner of things, let us make sure that the man or somebody is free in his or her mind, so that we can all have good mental health.
How I wish. I think this goes to our young parents, because the reason why I'm saying our young parents, some older parents did well, but you and I can attest to it, viewers, that most of our older parents, you can't even sit for 5 minutes to have a conversation, even the usual conversation, to speak of sharing what is bothering you. I wish this was really fixed for us, because when you go to the Western world, it's like they have that free spirit to express themselves, share how they feel, what goes on. But here in Africa, it's like, be strong.
Yeah.
Face your problem squarely. Don't let it bother you. Don't speak about it. Handle it your own way. Pray about it. Everything will be okay. Doc, people too are withdrawing. Some started with seeing counselors, therapy, going through that therapy. But there's a lot of stigmatization. Immediately, a friend told me, see, Akusia, I think I am done with the therapy, I'm okay. Like, but the therapy is supposed to be 6 months.
Mm-hmm.
You started just 2 months.
Mm-hmm.
Why?
Mm-hmm.
Like, Akusia. It's like the moment someone hears that you are going for therapy, like that perception that comes to mind first is, you are going through a lot. Why? Were you trying to commit suicide?
Mm-hmm. That's
why you are seeing a therapist? Or you are very, very sick?
You see, though we'll be treating suicide along the way, but you see that all of a sudden they say, the person that he went to work yesterday and came, we all saw her and did blah blah this, and then he has gone to commit suicide. Look, the signs were there, but they never saw it. The signs were there, and that's the more reason why it is very, very important that we should know the signs and symptoms of a mental illness. Mm-hmm. Look, somebody who is there, then all of a sudden, all of a sudden, then she started sharing his or her few things that he have. All of a sudden, the person sitting down, then he'll be saying, When you ask him, he say nothing.
Mm-hmm. Oh, and I'm just tired.
Yeah, just tired. Then the person will be there. Then all the time you sit down and put the hand under the chin like this. Is it not when we are mourning that we do that? Mm-hmm. If you see those things and it's becoming persistent, all the time the person is complaining, this is my son Kofi. Kofi, I like you. Then you take Kofi out and go and shop for Kofi and say, sometimes I just feel sorry for Kofi. You feel sorry for Kofi for what? They are the warning signs. He wanted to take his life. And he's also feeling for Kofi. The warning signs are there. But it is after the thing happened, because, so that was the reason why he was doing this, he was doing that, he was doing this and that. So if we should know the signs and symptoms early, and those things begin to happen, you tell the person, and the person may not agree, but you try to find a therapist for the person, and then the person is helped to come out. You see, somebody is raped, and then for I don't know how to put it, shyness of bringing that person who raped the lady out, who seems to be a prominent person in the society.
Yeah.
Then it is the mother is killed at home. Meanwhile, this young lady or young girl will not be taken to counseling, so that they have to speak to the person to change her mind, for her to accept what has happened. Because I usually tell my client that you cannot do anything about yesterday. You can't do anything about yesterday. Yesterday, I met you and I slapped you. Can you do anything about it? Mm-mm. But as for today, you have power over it that I shouldn't slap you. Because you see me coming and you pass your different way. Okay? So that when the person is made to accept what has happened, so that he should allow life to move on, but you take guard so that the second one should not happen. You are helping the person to overcome the stress in the person. But if you don't do that, you see, it flashes on the mind, it comes back, and it will be hunting the person. Meanwhile, you have seen the person, they have given you some few CDs to kill the matter somewhere. But do you know what your daughter is going through? You see? So we must learn, that's why I'm saying that we must learn to teach our children to be assertive. We should raise them in a manner that they should be able to complain over certain things that they feel they are not good. You know, parents of this generation, we are having problems. And those who are having problems are those who, the way they were brought up in the 70s and the 60s, they also want their children to be brought up in that manner. And that is the mistake they are making. In fact, the cheapest commodity, I tell people the cheapest commodity on the market now is information. That's the cheapest commodity. It's information. You tell your child something and then you go to the net straight. And he said, I know what I say, what I say is not true. So you see the father that you are nobody he can confide in. He has gone to say the thing on the net. It is at variance to what you are saying.
Dog, see, dear one, that is why you have to watch Hope Channel and watch Love at Home to be educated about all these things. And I told you earlier, this whole month of September, we are just focusing on mental health. So this is where time, Dog, you actually put your number out. Yeah. This is where time will permit us. But Dog, I would want you to mention out your contact. In case someone is going through that, you can speak to Dog. He is a mental health practitioner, so you can help Dog.
Yeah. If the topic that we discussed today and then the one that we discussed last week, if you have a nice relative, son, wife, husband, friend, who that person may be, you can call me on 0244 793582. I repeat, 0244 793582.
Thank you so much, Dog. So viewer, you've heard it. Just contact Dog to give you the help. Mental health is a serious issue, and please, if you can't help, don't worsen the issue. Stop spreading the message. If you've heard something about a colleague, a friend, a relative, please don't spread it. If you can't help it, don't worsen the issue. The best you can do for the person is to recommend a counselor for the person to go through therapy. You don't know the lives you will save by doing that. And we need to be vigilant.
People started calling.
As people started calling, right? We need to be vigilant as loved ones. We need to pay attention to the people around us. We don't want to lose them. You might not see it closely as we were speaking. They might still be happy and be laughing. Because before someone commits suicide, most of the time they look even extra more happy. And that is when they're about to kill themselves. So please, let's open our eyes. We should be good listeners to listen to people's issues and shut our mouth also when we do that. God will richly bless us. So this is where we end on mental health signs and symptoms. My name is Nana Akusia-Boakye, and I sat in for Efiasewa Mansa. Until we meet again, be mindful of your mental health.